just had a final question for Ms. Schauer. I was wondering if you could speak about specifically women veterans. And we've had a lot of conversation, obviously, focused on rural healthcare, but I think that those challenges to access for women is probably greater. But I was wondering if you could speak a little bit to that experience.
Yeah, our women veteran population, of course, we have a lot of unique needs. Military sexual trauma is probably one of the most prominent, though not isolated to women veterans, a higher percentage of women veterans. What I find in our community is hesitance towards using the VA because of experiences they had 10, 20 years ago, when you dig into it. And so just trying to encourage them that today's VA is different. And you're in a place where you'll be welcomed. And once they try it again, they see and they believe and they socialize it with each other. But I think it's getting them in that door. And I think the social isolation that you're talking about, I want to learn more about that program because that's really why our community was created, and hearing about the high suicide rates for women veterans, which as a nurse, having been a nurse for 15 years at that point, I was completely unaware of. And when we started our group, we had immediate energy behind it, and it just keeps growing, and it just shows that need for people. And often it does take asking them 2, 3, 4 times to come. But once they come, they're like so excited for the next meetup. So I do think women have unique needs that have gone a little bit unnoticed and unrecognized for a while. And I'm really happy that today's VA is seeing that and addressing that.
Thank you very much. I'll yield back, Mr. Chairman.